Karen.
Hi, how was your shift?
Pretty good, actually. Busy, but good.
Yeah, okay, excellent.
So, are you taking my gun?
I am, yeah. You can give me a report.
Nice. So, you probably don't know this gentleman because he just came in last night. He's a 28-year-old male. He had came in with a diagnosis of septic shock.
Okay.
He had a 6-day history of malaise, chills, fever, and came into the emerge, and at that point was fairly decompensated at that point. So they did full cultures, and he was started on Pip-Taz, broad spectrum antibiotic, and we're just awaiting those cultures so we can narrow that focus a bit. He does have family here. They've been in to see him earlier today, and they're out right now. They're just going to get some dinner, so
Sure.
they'll be back probably a little later. And I did mention that you were coming, so let's get started. So basically, CNS wise, he's a GCS of 10 with he's got an ET tube out of 15. His RAS, he's been about -1 to +1. With his goal RAS of 0. His ICDSC is -4. It's no delirium.
Sorry, just to clarify, the delirium, you said the score was?
-4. I'm sorry,
Sorry,
less
0?
than 4.
Okay,
Less
okay,
than 4.
okay.
This is actually a 3.
Great.
My bad, yeah. Pupils are echoreactive at 3.
Okay.
He is on fentanyl at 100 mics per hour. When I first came on, he was having a little bit of pain in his chest, and gave him a bolus of 50 milligrams of fentanyl, and that took his pain down considerably. He was much more comfortable.
Can he have bolus?
Yes, he's got orders
Okay.
for breakthrough pain.
Okay,
Yeah.
excellent.
50 to 100 mics as you need. He's also on midazolam at 5 milligrams per hour. That's been reduced. When he first came in, he was a little bit agitated, but he's calmed down considerably now. So that was down from 7 milligrams per hour, and I've just been titrating it slowly down.
Okay, great.
CV-wise, Tmax was 39.4. I gave some Tylenol. He came down to 37.8. That last Tylenol dose was 500 milligrams at noon. His heart rate's been in the 110 to 130 range. Sinus tach, no ectopy. His BP is 95 over 46 to 110 over 64. And his MAP goal is greater than 65. Pedal pulses are good, as are wrist pulses, so he's no issues there. He's got no edema at this point. Skin looks good, warm, dry. He is got an ET tube. It's 23 at the lips. He's on AC, so it's this control of 16 by 500. His PEEP is 5, and his FiO2 is 30.30. His respiratory rate, he's for the most part been riding at around 16, but he does have his own breaths up to about 20.
Okay.
Chest auscultation, he's got coarse crackles throughout, decreased air entry to the right base particularly, but generally decreased all over. I've noticed that there has been an increased frequency in the number of suction passes that I'm doing, so we had 16 for the shift.
Okay.
Thick yellow and fairly tenacious.
And they've sent his sputum for culture?
Yes.
Okay.
They did a bronch actually when he first came in.
Oh, okay, sure, okay.
GI-wise, his valve sounds are positive ×4. He is on, we started him on isosource just trickle feeds, and I'm up to 30 mils per hour.
Okay.
His goal is 80 mils per hour.
Just with 30 cc flushes?
Yeah,
Same?
Q4 30 cc flushes
Still water?
Still water, yeah.
Perfect. Okay.
We've also been checking his blood sugars, and they've been stable 4.4 to 8.3. We haven't required any insulin at this point.
Okay.
His abdomen is soft, and no bowel movements as of this time.
Okay.
He's got a right nair Celastic. I placed that in around noon when we started the feeds.
And I take it was confirmed on X-ray?
Yes, we
Okay.
did do an X-ray.
Okay.
Okay. He does have a Foley catheter. His urine output has been anywhere from 50 to 100 per hour. He was resuscitated, so he's 4 liters positive right now, but he seems to be spontaneously diuresing.
Okay.
The urine is pale yellow, and a culture was sent, but there's no outward evidence of any infection then.
Okay. And no specific goals at this point?
Basically neutral.
Neutral?
Yeah, we're
Okay.
gonna aim for neutral. He does, I'll just maybe go into invasively and talk about his fluids, but invasively he's got a right IJ triple lumen catheter.
Okay.
That also was checked by X-ray and confirmed. Also able to get blood back, so we'll get there.
Perfect.
Proximal port has got your CVP. The medial port is for our continuous medication, so he's got fentanyl at currently 100 mics per hour, Versed at 5 milligrams per hour, and he does have a little bit of norepion, so it's at 0.03 micrograms per kilogram per minute.
Okay. Has that been needing to titrate that?
I've been actually
today?
slowly going down. He was
Okay.
actually up to 0.5
Oh, wow.
on overnight at his most acute stage, but we're down quite a bit now. So.
Great.
And the distal port is your Medline. We just got saline right now going at 150 per hour. Oh, and I didn't mention that we do have a runner going with your meds, and that's NS820.
Okay, perfect.
So his hourly fluid goal they're looking at is about 170 per hour. So.
Okay.
With respect to labs, they were pretty much good. Just pull those up right now. I mentioned the gas already and the lactate. White cell count is elevated at 18.
Okay.
And the neutrophils are elevated as well. Otherwise, he's pretty good. I didn't see anything abnormal. So.
Okay. So just want to clarify that he's an R1 with no allergies.
Oh yes, absolutely.
Okay.
So he's an R1 and no known drug allergies.
Okay. And then just looking through the orders, so it looks like my next antibiotic is due tonight at 10 o'clock, the PIT test.
Yes.
Okay.
Yeah.
And everything was signed off, and so I don't have any questions
Okay.
about the medications. As for goals, just using the Levophed just to keep the blood pressure, the MAP greater than 65, and then just shooting for the goal RAS of 0.
Yes.
With my sedation. Okay.
Yeah. Oh, actually, I was just thinking, that reminds me, he is being fed, so no GI prophylaxis.
Okay.
But he has been started on heparin for DVT prophylaxis. I've given the first dose at 1800.
Okay, perfect.
So your next due in the morning.
Okay. Did the resident have a chance to do the med
Yes.
reconciliation? Okay. Okay. Excellent.
Great. Well,
Thank you.
have a good shift.
Thank you.